Hi everyone, welcome to Ura's Corner on the SWI channel. Today we'll be discussing everything about emergency cesarean section. A cesarean section can either be elective, which means by choice, or it can be an emergency like the name goes. If you're coming across our video for the very first time, please make sure you subscribe and turn on your bell notification so that you will get notified whenever we post a new video and you don't miss out on any of our juicy content. Alright, so if you're interested in finding out everything about emergency CS, please keep watching. So, emergency cesarean section is actually a surgical procedure that is performed by delivering a baby by going through the stomach and the uterus instead of the vagina. And in most cases, this is a chosen or a preferred means of birth when there are certain conditions that are confirmed that delivering the baby through the vagina is not a safe option for either the baby and the mother. All right, so it is very important for us to get all the details and everything we need to know at the tip of our fingers about elective emergency CS, whether or not it's an option you are going for as a pregnant woman or whether or not you expect it. It's good to have all the information that you need, so that you are enlightened about it generally. And the first thing we will start with is looking at the indications of emergency CS. Now, indications means what are the predisposing conditions or what are the circumstances that would determine whether or not your medical professional recommends an emergency CS to be done to deliver your baby safely. Now, the first instance that always leads to this decision is fetal distress. Now, fetal distress is when it's been observed that your baby's breathing is, there are changes in his breathing, or it's just been discovered that the process of labor, has affected your baby and the baby is no longer strong enough or is not, breathing well to be able to go through the entire labor process, and so the baby is in distress and an urgent decision would need to be taken to deliver the baby. So that's one condition that can make a doctor recommend emergency CS. Another condition can be failure to progress labor. Now, what this means is there are some people that go into labor, whether naturally or induced labor, but they've been laboring for too long, and the labor is not progressing. Labor happens in different phases. On another video, we can go into the details of that, but now there are different stages of labor, and at a certain time, so let's just say after like 8 hours, the woman is supposed to be in a particular phase of labor, after 10 hours, depending on whether it's her first time or, her second, third, or fourth time even. Yes, so now, if a woman's labor is not progressing according to schedule, in quotes, there may be a need to, have an emergency C-section, right? So that's also one major reason why that happens. So like the woman is losing strength and she has been in labor for so long and the cervix is not dilating. You've been laboring for 18 to 20 hours and you're still in 5 cm or 4 cm. There may be a need to panic, right? And then the doctor may recommend an emergency CS. Another reason why an emergency CS can be prescribed is if there are placenta issues with regards to either placenta previa or placenta abruption. Now, the placenta is like the connecting unit between the mother and the child in the womb. It is through the placenta that the baby gets fed in the womb and also the baby receives oxygen in the womb. In a situation whereby the placenta has left its normal position and has gone to block, this has gone down to the cervix area, right? The cervix area, which is supposed to be the passage for the baby, that means there's a problem and an emergency CS will need to be conducted. Another placenta issue may be abruption, where the placenta has separated from the baby during the course of the labor, and then they may need to, either carry out the emergency CS procedure to deliver the baby. Finally, another condition that may lead to an emergency CS may be maternal health concerns like preeclampsia and eclampsia. Those are not names that anybody loves to hear because it's a very terrible condition, and extremely fast decisions need to be made in such conditions. Preeclampsia is like a hypertension disorder, that mothers actually, have. Some people go through their course of pregnancy, either if they were already hypertensive before they got pregnant, or they are experiencing pregnancy-induced hypertension, or some people that had diabetes and the rest before they got pregnant. And then eclampsia is like the extreme of it, when she's already going into shock or having seizures, and it's an emergency situation. In such cases, there has to be a quick decision made about bringing out the baby and also saving the mother's life. Emergency CS involves rapid decision making. In pregnancy, it's always expected that, okay, you have an entire period of say 9 months, 40 weeks to make your birth plan, to make decisions, to buy things, go through different things that you need to go through in preparation for the arrival of your baby. The time frame for that decision to be made, so more like the time frame between life and death for a baby that is in distress, maybe just 30 minutes to 1 hour. Yes, it is that quick. And also, it is also interesting to know that the procedure doesn't take so long as well. It takes also between 30 minutes to 1 hour for the procedure to be completely done and the baby is delivered, and the mother and child are alive and well. That is actually the motto of SWI. We believe that a cesarean section delivery can also be a supernatural delivery. Another important thing to note about emergency CS is the incision type. Or before we talk about the incision type, let's talk about anesthesia. Anesthesia is used for an emergency CS, just like other surgical procedures, which would involve numbing the mother so that she does not feel any form of pain all through the procedure. And most times than not, the one used is the one that keeps you awake while the procedure is being done. In rare cases, they use the general anesthesia when you are, put to sleep and the doctor does the magic that needs to be done. Very, very importantly also, you should know that the incision in cesarean sections are mostly done, on the lower abdomen. They call it bikini cuts. Yes, so most times the bikini cuts, it goes smoothly, you heal well, and have very minimal scar, which does not even, it's called bikini cut because it allows you to still be able to wear your bikini. In very rare cases, especially in a situation or in a case whereby the mother-to-be or the pregnant person has done a previous surgery where there was a vertical incision, the doctor may just use that same incision line to conduct the emergency cesarean section. Otherwise, it's very rare for them to use the vertical cut, or most times than not, it is the horizontal cut that is used. Another important thing you should know about emergency CS is that the recovery will take a little longer than a vaginal delivery. So vaginal delivery, once a woman gives birth, within 24 hours to 48 hours, she's able to go back home, right? But for emergency CS, she will be required to maybe spend between 3 to 7 days in the hospital before she's discharged to go home with her baby. So you spend about a week in the hospital when you have an emergency CS. And the recovery is also for a CS mom, because of the incision, a CS mom will need a lot more support through her recovery process. So there are certain things that you shouldn't do because you have just gone through not just childbirth but also a surgery, and so you would not be allowed to do rigorous activities immediately after delivery. but then the recovery process is most times very smooth, and the incision area heals very clean, and you are back to your normal activity in just a couple of weeks. Yeah, so nothing much to worry about. Now, it is also very important to know the risk that can be associated, the risks and complications that can be associated with emergency cesarean section. And like every other surgery, because normally for every surgery there are risk and complications that can happen. So for CS, emergency CS as well, it's possible for there to be infection, there can also be bleeding, there can be reaction to anesthesia like I mentioned earlier. So these are some risk and complications of emergency CS. Otherwise, it's like one of the most commonly performed surgeries, and the success rate is always very high. Another thing to also note or to know about emergency CS is the emotional impact it has. For us in Nigeria, Africa, it's almost like it's fading out now, but before now it was almost like a taboo for a woman to give birth through CS. We don't want to go into all that right now, but there are emotional implications for a mother. When a mother has already put all her mind on having a vaginal birth and going home in 2 days, and a CS comes up, especially because it's an emergency, just like the name goes, it can destabilize the mother and get her into her feelings. Of course, it's also more expensive than vaginal delivery, so if the finances planned were just for vaginal delivery, it can also cause some emotional distress. So it is very, very important for parents to have this emergency fund somewhere that can cushion these things. And it's also important, just like you're watching this video now, in case you're pregnant, to be informed about get all the information that you need, so that when the time comes, you are not you're not put under so much distress, and then everything goes on smoothly, just to ensure that your baby is born safely. It's also very important to know that for postpartum care of a CS mom, it's almost the same thing as for a vaginal birth mom. The major difference may be just the care for the incision area. Otherwise, you're going to still bleed, just like the vaginal birth mom does, like bleeding vaginally after delivery. You would also pass through that. And then, of course, so the major difference is caring for your incision area. Other than that, there is really no much difference. So that's for the postpartum recovery. And then, of course, it's also important for you to know that for future pregnancies, if you have gone through an emergency CS, it will be recommended that you have an elective CS for your subsequent pregnancies. And then there is also a limit to the number of pregnancies that you are allowed to go through once you have an emergency CS. So this is something you need to know. And then it's also important to mention here that there are also options for you to have a vaginal delivery after you've had an emergency CS, and that's called VBAC. I think that's vaginal birth after cesarean section. So VBAC is possible, but then a lot has to be discussed with your doctor for you to come to that decision, and you get all the support you need to have that done. Finally, and very importantly, just like I hinted in the last point, you have to keep constant communication with your healthcare provider all through your pregnancy. It is very, very important. And also your post-surgery experience, everything you are going through, you need to constantly update your doctor so that you have a seamless journey, and then everything goes on fine. These are the very important information that you should know, that summarizes all about emergency cesarean section. I hope you found the video interesting, and if you did, please subscribe, share the video, and also like it so that YouTube recommends our videos to others to watch as well. Thank you for your time, and I will see you in the next one. Bye.